Hello, Ben. How are you? Glad to see that you decided to come back for counseling.
Hello, I'm doing okay. How are you? I'm glad to be back.
Good, good, good. I got a couple of things that I need to cover before we begin our session, and that is my professional disclosure statement. As you know, I'm a graduate student working towards the completion of my master's degree in professional counseling, and I'm practicing my counseling techniques, and therefore we will be recording today. This session, but my only people that will see this is my professor and my classmates. At the end of the semester, the tape will be destroyed. Likewise, you should know that there are limitations to counseling. Please note that it's not possible to guarantee any specific outcome. However, together we will work toward achieving the best possible results for you. So I want to go over your rights as a client. It is your right at any time to inquire about the process and procedures being done during the counseling relationship. You have a right to refuse to see me and to request to see another counselor. Once you begin counseling with me, there's no obligation to continue. At any time, if you don't like what's being done or said, then you can talk to my supervisor. My services are rendered in a professional manner, consistent with ethical standards of the ACA, that's the American Counseling Association. And if you have a complaint regarding malpractice, this can be reported to my supervisor as well. Understand that there is a confidentiality, and everything we discuss in this section will be kept confidential. If I determine you are imminent danger to yourself or to others, those are the things I have to report. I have to report child abuse or elder abuse as well. If your records are subpoenaed by a court of law, then I have to release that. If you disclose any sexual contact with a mental health provider, whom you've had a professional relationship, I would have to report that as well. Any information you request by your HMO insurance company, like an HMO, like I said, or EAP. If I'm directed in writing to disclose information to someone of your choosing, if you bring a malpractice suit against me. So, as you know, this is being recorded. We've already got your signature for the okay. So, I appreciate you letting me record you today. So, how have things been going since our last session?
Things are not much better. I'm still having bouts of anxiety and panic attacks.
Oh, I hate to hear that. You're still experiencing bouts of anxiety and panic attacks. Have you tried any of the coping skills that we discussed from our last session?
Yeah, but I must admit I haven't used the coping techniques you suggested last time, and I would like to go over those again if we have time.
Of course, we'll make time. Uh, no problem at all. Sometimes the coping techniques can be a little intimidating to try on your own at first, but if you practice them, they may help lower your anxiety, and that's what we're looking to do.
Okay, sounds good. I promise to give it a try this time. I really thought I could overcome it on my own without trying to cope and exercise it, but I see I need some assistance.
I hear that you say you thought that you could do it on your own. Using the coping exercises are still doing it on your own. It's not diminishing your strength or your abilities or anything. You're just going to use the tips and techniques, but it's going to still be all up to you.
Okay, I see what you're saying. It's just my male ego gets in the way sometimes.
No problem. Everything will be fine. I understand that. We will practice the coping skills together before you leave and make sure that you're comfortable doing them before we finish the session today.
Okay, that sounds good.
Have you, since we last talked about it, I know you hadn't disclosed your anxiety or panic attack issues to your wife. Have you told her anything about them since the last session?
No, I still don't want to burden her with my problems when she has such larger health issues that she's dealing with.
I admire you for that. I understand you're putting your wife first since she is dealing with serious health issues.
Yeah. Thanks for understanding my position on this.
No problem. I actually admire. I admire the way you feel about your wife. Have you noticed specific situations that cause your anxiety levels to rise, or what brings on the panic attacks?
Usually, overthinking raises my anxiety, and anytime my wife receives not so
Mm-hmm.
good news about her health,
Mm-hmm.
I have a panic attack while waiting for her to come out of surgery. Luckily, I was in the restroom stall, and no one was able to see that happen to me.
Oh, I hate to hear that. What physical symptoms do you experience during a panic attack?
When I have a high anxiety or panic attack, I experience racing heart, difficulty breathing, pains in my stomach, and sometimes numbness and tingling in my hands.
I hate to hear that you're experiencing some very troubling symptoms. We will try to get you back on track with the coping skills, so we can lessen the amount of anxiety that you're feeling, and also try to limit those panic attacks.
Okay, I'm really willing to try anything at this point.
Okay, I'll tell you what. Let's go over those coping skills now. You good with that?
Mm-hmm.
Okay.
Yes.
Okay, so we talked about the deep breathing the last time you were here. I believe those are very beneficial. Sometimes, if you can do that deep breathing when you feel that anxiety rising or the panic attacks coming on, you may be able to catch it right there and lessen it. So, what we're gonna do is what they call the 5-5-5 breathing method. To do this, you breathe in for 5 seconds, you hold it for 5 seconds, and you release it for 5 seconds. And we usually do these in sets of three. So, do you think we could go ahead now and try the deep breathing?
Mm-hmm.
Okay. So, sometimes it also helps if you close your eyes while you do this, so you kind of block out everything that's going on around you and only concentrate on your breathing. Okay. So if you would just sit up straight and put your hands on each knee, and we will start by the first one by closing our eyes, breathing in for 5, holding for 5, and releasing for 5. We'll do that 3 times. Okay? Here we go. Inhale, 5, hold it, release. Again, 1, 5, hold it, 5, release. One more time. Inhale, hold it, release. Feel any difference in your body after those deep breathing exercises?
Yeah, a little bit.
Would you say it relaxes you?
Yes.
Okay, great. So this is a tried and true method, and don't forget to employ that. I think you'll do good with that exercise. Okay, so the second coping skill we're going to work on is something called anxiety busting. It's a little more involved, but it'll help you. I'm sure it'll help you with the anxiety. So the next time your mind is stuck on anxiety and worry, try this exercise. So what we're going to do is we're going to look around the room, wherever you are, outside the room, wherever you may be at the time when you feel your anxiety rising. And the first one is that you're going to find 5 things that you can see. And you're just going to concentrate on those 5 things. Like I see the chair. I see the window. I see the wall. So you're going to just look around whatever room you're in and concentrate on 5 things that you can see. Go.
I'm supposed to say them all out? Or just
You can
focus?
in practice, or you can focus with whichever one works for you. You rather just focus on them?
Yes.
Okay, excellent. So after you find those 5 things, you find 4 things that you can feel or that you can touch right where you are, whether it's a table, a wall, the ground, the chair, the desk, and you find those 4 things. And after you find those 4 things, then you go to 3 things you can hear: birds chirping, the television, someone talking, because most of the time you're going to be in an environment when these attacks come on. So now you find those 3 things that you can hear. What these things are doing is taking you away from the panic attack or the anxiety and getting you to focus on other things. And then after you find the 3 things you can hear, you're going to find 2 things you can smell. Whether you're in the kitchen and you can smell the coffee brewing, someone's perfume or cologne, your shirt that smells like laundry, anything you can smell or sense with your nose. So those are 2 things you can smell. And then the 1 thing you can taste, whether it's gum that's in your mouth, a mint, food, just 1 thing that you can taste. So what that 5, 4, 3, 2, 1 does is to take your attention off of the anxiety or the panic attack and put it towards other things. And while you're not concentrating on that attack, the level or the intensity of the attack will go down. Think you'll be open to trying that at home or at work or wherever you may be?
Yes.
Okay, sounds good. And the last coping skill we're going to cover, and this is something that we already talked about in your last session, was exercise. And you told me, you are pretty committed to exercise. Have you still been exercising?
Yes.
Excellent. So with exercise, what happens is moving around releases the hormones and the endorphins that relax the body and improves your mood. Regular exercise can help reduce panic attacks over time, which may lead to a reduction in the symptoms and the severity of the panic attacks. So what do you do when you're exercising?
I lift weights, do cardio, and afterwards I'll sit in the sauna.
Okay. So after you do that, do you usually feel very relaxed?
Yes.
In a better mood?
Mm-hmm.
I would say to make sure and keep a regular exercise schedule while we're learning to deal with the panic attacks and the anxiety and the high anxiety. Okay. So keep up with everything that you're doing. I think you're going to do well if you just go ahead and employ the coping skills we talked about today. As a matter of fact, that's going to be your homework. And when you come back, I want you to let me know how it's going. A good way to keep up with that, maybe you can journal or put in your phone notes how your exercise is going, how many days you exercise. But in addition to that, I also want you to keep track for me for the next 2 weeks, because we'll see each other in 2 weeks. How many panic attacks you had? What was going on when the panic attack started, or even with your high anxiety, if it's not a full out panic attack, when did it happen? What was in the environment? What were you doing? So that's your homework. So I want you to make sure you note that down so we can talk about it when you come in 2 weeks. So I'll see you in 2 weeks. That's okay with you? 2 weeks from today, same time and schedule?
Yes.
Okay, sounds good. Again, thank you for coming in. And if you have any questions or anything after you leave here, please feel free to give me a call back. You have my contact information. And we'll see each other in a couple of weeks.
All right, will do.
Thank you, Ben.
You're welcome.
Bye-bye.